The topic of our project is cultural diversity, people with visual impairment in a dental setting. We will be discussing how to navigate client care for someone who is visually impaired. It is important to consider various factors in order to build client rapport. To kick off the presentation, I'm going to give a brief case scenario. Miss Sarah Wilson, 67 years old, fully visually impaired, is waiting in the dental office. The hygienist walks in and introduces herself to Miss Wilson. Hello, Miss Wilson. My name is Tia, and I will be your dental hygienist today. Please follow me. Miss Wilson says, I can't see where you are going. The hygienist says, oh, here, let me show you, and grabs the client's arm to bring her to the dental hygiene chair.
Attitudes, beliefs, and values. Visual impairment can be colorblind, partially blind, wearing contacts or glasses. Blindness can happen with time and age or related to an accident or infection. Service animals must remain with the owner in any setting, including a dental office, and clients may like to wear their own glasses for comfort.
Unique verbal and nonverbal gestural considerations. You should announce your arrival and introduce yourself to your client. Speak directly to the client and adopt normal postures and positions. Also continue to use words such as look and see normally. Let the client know if you need to leave the room and why.
Cognitive and/or physical considerations. A person with full visual impairment may take longer to learn new information. If there is a new procedure or technique being taught, give descriptive details. Ask your client if you can help guide them. If they say yes, ask if you can hold their arm. Verbally give directions as you're guiding, including any hazards. Provide accommodations such as information in Braille formats or audio recordings.
Referencing back to the original case scenario, the pros that occurred was that the hygienist introduced herself professionally to the client. The cons was that the dental hygienist did not review her health history prior to greeting the client. She was unaware that her client was visually impaired and failed to ask her client if she could guide Miss Wilson to the dental hygiene room. Some other things that are important to consider is to direct the client and seat them in the dental chair. Make sure that the chair is lowered. Ask permission to start the medical history and inform consent. Be very detailed oriented. And make sure to notify the patient when they will be seated back in the dental chair.